This rhythm is normal sinus rhythm with second-degree atrioventricular block Mobitz type 1. Second-degree AV block Mobitz type 1 occurs due to fatiguing of the first third of the atrioventricular node. You will see a sinus rhythm with progressive prolongation of the PR interval until the AV node completely fatigues and fails to send a ventricular beat through. This results in a dropped QRS complex. Here you see a sinus beat, PQRS, followed by another sinus beat, PQRS, with a longer PR interval, followed by another sinus beat, PQRS, with an even longer PR interval, and then a P wave with no QRS following. The cycle then repeats, beginning with a sinus beat, PQRS, with a relatively short PR interval. This rhythm is normal sinus rhythm with second-degree atrioventricular block Mobitz type 2 and narrow QRS complexes. Second-degree AV block Mobitz type 2 occurs due to dysfunction of the latter two-thirds of the AV node. Here the AV node conducts impulses to the ventricle correctly some of the time, but completely fails at other times. You will see sinus rhythm with consistent PR intervals, and then suddenly there is a dropped QRS. Here you see a sinus beat, PQRS, followed by another sinus beat, PQRS, followed by another sinus beat, PQRS, and then a P wave with no QRS following. The cycle then repeats. In this example, the QRS complexes are narrow since the impulses that go into the ventricles originate from a site higher in the AV node, allowing normal conduction into the bundles. With second-degree AV block Mobitz type 2, you may see one of two patterns on the rhythm strip. The first one, as seen on the top rhythm strip, shows most of the P waves followed by QRS complexes, and occasional P wave without QRS complexes. The other pattern, as seen on the second rhythm strip, shows many P waves without QRS complexes following, and only a few P waves with conducted ventricular beats. Either way, the AV node works normally sometimes, yet totally fails at other times. Thanks for watching this video. For more about ECGs and arrhythmias, take a look at our full catalog of courses.